Welcome everyone. Growth means we become more complicated and more efficient. So professional growth means we also become more complicated and more efficient. So today I am going to discuss on what is called a Nabothian cyst. So also, when cysts are found at different geographical locations in the body, they are also given different names. So what we have here, this image was acquired through vaginal ultrasound technique. So you can see here, that's the uterus that we have there. So this is the bulb of the uterus. And you can see this substance, that is the biggest part of the uterus. That's the myometrium. And then you've got an echogenic stripe or layer that is thick here. This is the endometrium. And you can see this is thick like that. So this is in keeping with the secretory endometrium. This patient is about to experience a period. And then the echogenic layer that we have here, that's the outer layer of the uterus, is called the perimetrium. And you can see mild free fluid here in the posterior cul-de-sac. And then what we then have here is the cervix. So you can see that the cervix or the endocervix is echogenic there and is continuous with the endometrial stripe there. So just posterior to the endocervix here, you can see there's this cystic structure which is anechoic here and with the thin walls. So this is what we call a Nabothian cyst. So a cyst that you find in the substance of the cervix is called a Nabothian cyst. If you find that cyst inside the substance of the vagina, you call that a Gartner duct cyst. Ladies and gentlemen, let me tell you this. If you make an effort to learn one pathology per day, it means in 7 days, you have learned 7 different pathologies. In 2 weeks, you have learned 14 different pathologies. What about in a month? What about in a year? What about in 5 years? What about in 10 years? So let us make an effort to become more complicated and more efficient for the good of our professional growth, also for the good of humankind in terms of our service provision to the generality of the public. Thank you.